Good morning! And if this is your first video ever clicking on a Frey Life video, welcome. I am Mary.
I'm Peter, and this is Ollie Boy.
That's his tail anyway.
Don't you think we're better together? Oh, I think
We are the Frey Life, and Mary takes this treatment once a month.
Every 3 weeks.
Every 3 weeks. I guess that's more than once a month. Called IVIG.
Yes. So I feel like there are a ton of questions about like what is IVIG, and when I first started this treatment I had all of those questions. So now that I'm about 1.5 years into the treatment, let's answer some of those questions.
So IVIG, how did it all start?
So about 1.5 years ago, or maybe 2 years ago, my Cystic Fibrosis team started thinking what else could be going on with my body. I had kind of a steady decline going on, and we were already treating what we could treat with antibiotics, and like I was already getting good airway clearance, and like we had covered all the normal CF bases. So they started running more blood work and kind of more extensive blood work that wouldn't be typical for a CF patient, and they started seeing some weird numbers with my immune system. So then shortly after that, I was in the hospital, I was inpatient, and the immunology team came in to kind of talk about those blood work numbers and talk about possible options. And one of the things, their biggest recommendation was, I think we should try IVIG. And then I was like, what's that? So that was about 1.5 years ago.
Yeah.
When it all started.
Yeah, and I guess that leads into the next question of, is it a cystic fibrosis treatment?
Right. Tricky question. The answer is no. Not
really.
Not really, not directly. If you meet a cystic fibrosis patient, it's not like, oh, are you doing IVIG treatment too? Like, it's not super common. It's kind of, the way that I imagine it is that my body has cystic fibrosis, and everybody's CF, looks a little bit different. And I think my body has a weird immune system, like a weird immunodeficiency thing going on.
And Mary's body has weird blood stuff in general. She's got portal hypertension, and so her spleen sucks up blood cells. And in that whole process, as we talked to the immunology team, it was kind of evident that her immune system, because of all of this, was perhaps being compromised and perhaps not equipped to fight CF things as adequately as it should, which wasn't like a super common thing for CF that we would even be aware of.
Right. So I'm really glad that they were doing all that extensive blood work to figure this out. And they were super thorough, and I was glad to meet with the immunology team and get them kind of on board as part of our care team. And it's been when we first started, we were like, okay, we'll try it. But along with a lot of my other medications, which I don't always see benefits from, like I do IV antibiotics, but I don't necessarily see benefits from it, we were like, yeah, we'll try it, and it would be great if it did something, but we'll see. Only time will tell.
Okay, so that brings us to the question of, what is IVIG?
All right, I'm actually going to read a definition because I think that will do the best job of explaining it. Intravenous Immunoglobulin, IVIG. A sterile solution of concentrated antibodies extracted from healthy people that is administered directly into a vein or into my port. It's used to treat disorders of the immune system or to boost the immune response to serious illness, also known as intravenous gamma globulin, IgG. So there you go.
Yeah, and so that's a technical definition. All right, give like what you picture it as.
I know that it is when somebody gives blood, like at a blood donation center, the immunoglobulins can be extracted from that and then processed in a way that then becomes what I know of as IVIG, which is a clear liquid.
So they take the blood of countless people, I think probably thousands of people, and they take out of that blood these antibodies or immunoglobulins. And antibodies are what are in my body, your body, most people's bodies to fight, the cold, or fight things in the environment, or fight bacteria, or all of that.
Intravenous immunoglobulin is a blood product prepared from the serum of between 1,000 and 15,000 donors per batch. So each time I receive it, I'm getting the antibodies of thousands, between 1 and 15,000. I think what we were told is like 3,000.
I don't remember, but the reality is it's a whole lot of antibodies, and I kind of view it as a little bit of like this like Spider-Man juice, where like, I don't know, you're getting like the superpowers of a lot of people.
Yeah. It's kind of mysterious, but I'm really thankful for it, that it's available, that I was approved to try it, and here I am a year and a half later, and we're still doing it every 3 weeks.
So how do you actually do IVIG? Maybe somebody watching clicked on this video because their doctor said we need to do IVIG. So how do you do it?
So I do IV, intravenous immunoglobulins. There are other ways to administer it, like subcutaneously, but right now I'm doing IVIG. When it started, I was inpatient, and so my first dose of this, like my first infusion, which took like 4 or 5 hours the first time, was done inpatient. So I was being monitored by the nurses and by heart monitors and everything to make sure that my body wasn't going to react. I was given pre-medication Tylenol and Benadryl to try to prevent a reaction. And I think that it can be a reactory drug. People can react to
reactive?
it. Reactive drug? Whatever.
Reactive inducing drug?
Yeah.
Reaction inducing drug.
There you go. Because it is variable, because it's from blood donors. So it's not like it's got that variant in there. So people can react to it.
Even, like, Mary's been doing it for a year and a half. This dosage she could react to, even though she's never reacted to it before.
So that very first time and every single time since then, I take pre-medications, pre-dose Benadryl and Tylenol to help my body prevent those reactions. So then I started in the hospital, and then for a few months, I don't remember exactly the time, when I was outpatient, I would go to the outpatient infusion center, where it's basically a day hospital room where I'd be there for 5 or 6 hours, a little bit of time before the infusion and a little bit of time after, and then the hours that I was having the infusion, and the nurses would administer the infusion there. Through my port, I have a PORT-A-CATH in my chest, which you put a needle in, and it's instant IV access, and that's how we administer it.
Yeah.
And so that was for a few months. We went to the outpatient infusion center, and then every once in a while I'd be back in the hospital, so the nurses in the hospital would do it, then I'd be outpatient and all of that. And then we looked into doing it at home, and so a home nurse came to the house and trained us on how to take it from this glass bottle and put it into the IV bag and do all of those steps. So the nurse came a couple of times and then, taught us how to be sure to monitor my vitals and make sure that I wasn't starting a reaction or anything like that. So the nurse came to the house a couple times and then signed us off as independent. And so we do it at the house every 3 weeks independently. The home care company sends me the medication and all of the supplies that I need, not only for my port, but to, set up the whole infusion. I have a home IV pump. I feel like I'm on a commercial.
It's already pre-programmed for her dosage, so once we get it all set up, she gets rolling. We hook up her port, I've never said it that way, access her port.
Yep.
And it's pretty straightforward from there. But it takes about 4 hours.
Ish.
Yeah.
And every time the pump is programmed to up my dose every however long it is, 30 minutes or an hour, to make it go faster. That's just how the infusion goes. And every time it beeps, I'm supposed to take my temperature and my blood pressure to make sure that my body isn't starting with a reaction. So if we were to see a change in temperature or blood pressure, we would kind of be clued in. So my body's not liking this. I've never had an issue with it, and I'm really thankful for that. There can be some side effects with IVIG. I've heard that there can be some pretty extreme headaches, maybe fatigue, and that sort of thing. I've never had a direct headache from it. Sometimes I get headaches, and in the very beginning, we thought, oh, maybe they're IVIG headaches. A year and a half down the road, we realized, nope, I don't get those headaches. I used to think I would get tired after doing it, like the next day. Now I'm just really used to it. I will say the one thing I did notice was I had stomach issues like 5 hours after my infusion for the first like 6 months. Like, I need to go to the bathroom right now. Like, pull over on the side of the road. That totally happened one time. And it was just kind of like diarrhea one time each month after I did it, or every 3 weeks or whatever. And ever since like a year ago, that hasn't really happened. So I guess my body's just used to it now.
So one last question is, we're a year and a half down the road. What do you think it's making a difference?
So when I started IVIG, they said, we're going to give it 6 months, which we then changed to 8 months. We're going to give it 8 months before we judge and before we decide whether to continue or stop. And at about 8 months in, my body began to experience some stability. And I had been in a pretty steady decline. My lung function was declining, my weight was declining, my body was really quite struggling, and I was being treated with antibiotics, and I was in the hospital for weeks and weeks, and I was, we were doing everything we could, and for those 8 months, the decline was continuing, and then right at about the 8-month mark, everything kind of leveled off, and we were like, what is this? What is happening? Why? This is amazing. Yeah. And so we thought maybe this is a fluke, maybe, what could it be that made this difference, stop the decline and actually bump me up a bit? And that was about a year ago. And I have been stable. Now, it has not cured my infections. It has not cured my cough. It has not cured my weight. We've acquired some new tools in my life. I now have a feeding tube, so that has probably added to some of my stability, being able to get good nutrition. But we don't know exactly how or exactly why, but we do attribute some of my stability to IVIG.
Yeah, and like Mary said, we don't know how much to attribute to this because there are so many factors. We're constantly treating Mary with IV antibiotics as well for her lungs, and at the end of the day, there's so many moving parts. Yeah. I don't think we can definitively say like that IVIG is, we think it's helping, but I don't think we can definitively say anything about it, except that what we can say is Mary is in a more stable spot, despite the normal CF progression, and because of that, we're not going to change anything. We're going to keep on going.
Right. But within that year of stability, I also am growing a new bacteria in my lungs, actually maybe 2. It's like we are thankful for that kind of stability, but also in the midst of that, still trying to figure out with all the new issues that have popped up, how are we going to treat those? And so I'm just saying, like, it's been a complicated, stable year. I guess that's what I'll say.
And in many ways, I view IVIG, I don't know if this is a correct way to view it, but kind of as like a regular oil change for maintenance for Mary's body to, like, I know you don't like the car analogies, but
I'm good with that.
But just to give like an analogy of, we don't see it like giving her superpowers and like fighting CF or anything, but perhaps it's helping to just maintain.
So we are grateful for it, and with that, I need to go stick a needle. Peter's going to stick a needle in my chest.
And if you're new around here, we make new vlogs every day. So, as
always, we will see you tomorrow. Good night, and don't forget, We always end with Ollie Boy. Good night,
This
Ollie.
little guy. We will see you tomorrow.